Đâu, negada.
Sio Nagad, Corey Bunch, Dawado. Hello, everyone. I'm Corey Bunch, Chief of Staff of the Cherokee Nation. Welcome to Jalagi, wherever we are. In today's episode, we will be discussing health and wellness, both physical and mental, individual and communal. We'll discuss how Cherokees will benefit from the new Cherokee Nation Public Health and Wellness Fund Act, talk with our nation's mental health experts, and discuss addiction, alcoholism, and opioid use in our communities. We'll also touch on the cultural values that shape Cherokee Nation's unique approach to these topics. I'm now honored to introduce a familiar face, Wade, manager of the Cherokee Language Master Apprentice Program and chief of the Squirrel Ridge Ceremonial Ground, who will lead us in an opening prayer.
Oseo Nagadama, Wadegali Scare Dawadon, Eliwus Idadoli Stan. Oh Hanadu, oh Hanadu, oh Hanadu, oh Hanadu, oh Hanadu. Come, Scarnathanahin, got Squoggalan at her home, a han head dog hasty, so indeed, Jogadan doggy, head dog hasty. Eliwus is ski staley scarcely, Ojaya is sasting. Got Squoggy Diggyami Diggas and Nigadanu, yes, Dahina, Chicanese. No zig, used the how will you to do lane, no gadante cohiga. Sawa igaligo hasty, Sawa igadan doggy, Une gigadan doggy, Igado hasty. Do you Unega, Ganana, Moji Stawa Durgan. Skiak says tasting. Ski steli scarcity. Skia nagali squirrel. It's a yelly leeches, negard, gohus, nadane home. Skiwu negasta, wadon.
Wade. Mental and physical wellness have always been priorities for the Cherokee people. And in these difficult times, it's important to remember how our values shape these cornerstones of our culture. To quote former Principal Chief Bill John Baker, if you don't have your health, then you have nothing. Here's what you'll see on today's show. First, we will hear from Principal Chief Chuck Hoskin Jr. His address will be followed by a discussion with Deputy Principal Chief of the Cherokee Nation, Bryan Warner. We will ask them some of the questions our audience has sent us in advance of the program. Next, Cherokee citizen and ultra-marathon runner Lori Enlow shares with us the physical and mental challenges of being a high-performance athlete. We will discuss new Cherokee Nation physical wellness initiatives with Lisa Pivec, Senior Director of Public Health, and Canaan Duncan, Senior Public Health Advisor. After that, we meet a Cherokee citizen and Cherokee Nation employee who opens up about his struggles with addiction and how he helps others overcoming their own challenges. This will be followed by a panel discussion with Cherokee Nation behavioral health professionals, Senior Director Juli Skinner, and Director of Medication Assisted Treatment Program, Ashley Lincoln, will discuss the issues and efforts across the Cherokee Reservation. Tribal Councilor Legg will talk about his hopes for our current wellness initiatives being planned throughout the reservation. And finally, we will hear from Community and Cultural Outreach Director Kevin Stretch, who will wrap up the show for us. We hope you will stick around for everything we have in store for you today. It's now my pleasure to introduce the Principal Chief of the Cherokee Nation, Chuck Hoskin Jr., for his remarks.
It is my honor to address you again this month on the Cherokee Wherever We Are broadcast. Cherokee Nation is strongest when our people have healthy bodies and minds. Too many Cherokees suffer with health conditions that could be exponentially improved with easier access to exercise, healthy food, and support for their mental well-being. It's an issue we all face as individuals, being more active and eating better. Sadly, the pandemic exacerbated people's unhealthy habits and lifestyles. However, we are beginning to turn things around with a more holistic approach to healthcare. Within our tribal health system, we know it is much healthier and less expensive to address these wellness issues before they become a medical emergency. Spurred by that philosophy, Deputy Chief Bryan Warner and I proposed the Cherokee Nation Public Health and Wellness Fund Act a year ago. That law allows the tribe to spend millions annually on wellness centers and addiction treatment for our citizens. Funding for this initiative comes from revenue collected by Cherokee Nation Health Services through health insurance claims. That means over $12 million will be spent every year for addiction treatment facilities, wellness centers, and related programs. These revenues allow us to reinvest in improving health care and the overall health of Cherokees. We're building new facilities across the reservation and expanding part of the W.W. Hastings Medical Campus to be the hub for behavioral health and wellness programs. We created the Task Force on Physical Wellness, led by former Cherokee Councilman Canaan Duncan, that is helping us plan how to execute this very important work at the community level. It will also help us shape Cherokee Nation's wellness programs for the next decade. We'll start with plans for a $10 million wellness center in Stillwell and a new community center with wellness space in Kenwood. Opportunities for wellness programs and facilities abound across the reservation. You'll learn more about these initiatives later in the broadcast. We recently celebrated the one-year anniversary of the Public Health and Wellness Fund Act by expanding it. Under the new act, we will exceed our original $12 million target for mental and physical wellness programs, and we will dedicate funds from our recent opioid settlements to address drug addiction. Last fall, we settled our pioneering litigation against opioid distributors and will invest $15 million from that settlement over the next 3 years to help construct drug treatment facilities. We will start with a residential treatment facility. It's a start down a path of healing. It will take more to build the kind of comprehensive mental health and drug treatment centers the Cherokee people deserve, that is respectful and inclusive of our culture, but it's a solid start. It is fitting that the same industry that inflicted so much injury and trauma on the Cherokee people is now paying to help build facilities that will generate hope and a renewed focus on healing. That, my fellow Cherokees, is a measure of justice. These opioid industry dollars will go to build our own addiction treatment facilities because I think it's the most effective long-term strategy. Cherokees taking care of Cherokees. We want to bring about something transformational to our people and knock down the barriers between mental health and physical health. We're developing plans for a comprehensive behavioral health system that features inpatient and outpatient services, as well as residential and transitional living centers. We want to ensure families can stay together as they're going through recovery, and once recovered, get our people back into the workforce. Good health for our citizens means having good mental health, just as much as having good physical health. That takes a holistic approach, bringing wellness to mind and body. At the end of the day, we will be successful when the Cherokee people, both individually and collectively, achieve a healthy balance. You have asked for more resources for mental health, addiction treatment, nutrition, and physical fitness. Deputy Chief Bryan Warner and I, along with the Council of the Cherokee Nation, are delivering. Yes, improving health and wellness will help save money in our healthcare system, but we know the most important return on this investment is not measured in dollars. It is measured in longer, healthier, and happier lives for our people. We all share one goal for ourselves and each other: wellness. Wado.
Wado, Chief, for joining Deputy Chief Warner and I for a discussion about the subject of mental and physical wellness.
Good to be with you.
Each of these questions may be directed toward either of you, but please feel free to share your thoughts. As you gentlemen are painfully aware, physical and mental wellness are paramount to our longevity. As individual Cherokees and as a tribe, give us a sense of where the tribe stands in terms of dealing with mental and behavioral health, including the recent lawsuits regarding the opioid addiction lawsuits. And Deputy, let's begin with you.
Well, I think, where we stand at today is we know we've got a lot of work to do. I know that when the then Attorney General Hembry set out to take a look at that industry and what they've done, and particularly to Indian country and that predatory nature. I think we're starting to see some of those things come to fruition with the settlement and the initiatives that Chief has undertook, along with this public health team, along with the behavioral health team, are going to be paramount into how we can actually get to a healthier future for a lot of people. So for me, it means everything, and I know that the staff that's in the trenches, looking at these initiatives, going out and asking them questions and figuring out what does our strategic plan look like when we're starting to initiate these dollars to help us become healthier, not just physically but mentally, and ultimately, like the elders will tell you, maintaining that balance. They often talk about the white path and the red path, and how you have to have balance between those two, that path of peace and that path of war, and that also comes into mind when you're talking about head to heart balance as well. So,
well, that's great to hear. What do you hope the programs and initiatives your administration will have, that you've introduced on these subjects, will accomplish?
Chief, if you've got anything to say, but I will tell you this: I know that Chief has a vision and in the accomplishment of what, if we can get to that healthier side. But I'd really like to hear kind of what Chief's vision and what is that hope, Chief, that you have for that future?
Well, first of all, Deputy hit it on the head a while ago. We've got some talented men and women already doing great work in our behavioral health system. We just need to do more of it. We need to give them more help to do what they do. That's where these initiatives come in. So legislation that he and I proposed last year and updated this year is going to infuse those programs with millions of dollars. I mean, it'll be north of $12 million additional every year towards efforts surrounding behavioral health and also physical wellness. I'm talking about opportunities to work out because it's about mind, body, and soul. Nutrition, from going to see a therapist, helping kids deal with some struggles that they have. There's all sorts of programs that we already have we need to scale up. We do see some gaps in what we do in behavioral health, but the deputy and I, when we see gaps, we just see opportunities. If we have resources to commit to seize those opportunities. And so the programs that we want to really help are those that are already working, and they're working, they just need to be scaled up. We also need to recognize that when it comes to the big troubling problem of addiction, we've got to do a whole lot more. And so some of the programs will involve building new addiction treatment centers. We've got our work cut out for us. The opioid lawsuits that the deputy talked about have generated dollars for the Cherokee Nation. We have to put those dollars to work immediately, and he and I have a plan to do it. The council is behind it. The Cherokee people in the next few years are going to see a drug treatment facility, multiple facilities start to spring up to help bring some healing about.
Well, that's really great. Millions of dollars, millions of new dollars. So terrific. Chief, I know that First Lady January is a strong advocate for the new women's shelter, One Fire, as well as many other wellness programs throughout the reservation. Could you talk briefly about some of those programs?
You know, often when we think about a shelter for victims of domestic violence, we're thinking about the criminal justice aspect of it, making sure that those victims are protected and making sure the assailants, the perpetrators are held accountable. That's important, but it also has an important mental health component. I mean, people who are survivors of domestic violence are dealing with so much, not only the physical trauma that sometimes comes with that, but also a great deal of mental anguish that comes along with that sort of abuse. And so this transitional living facility that we have in Stillwell that will be opening soon was really important to the First Lady. An opportunity to help more victims of domestic violence, not only with that immediate need. Sometimes it's important to get them to a shelter, get them to temporary housing, but we have to make sure we understand that there is a long path to healing, and that path needs to include making sure you can keep your kids with you in a safe place, making sure you can get employment, because often victims of domestic violence are displaced from employment Often housing issues become exacerbated when somebody escapes a domestic violence situation. So this transitional living center will include some houses and some apartments that can really be a safe haven. But again, it's as much about the criminal justice side of domestic violence as it is about the healing side and the mental wellness. And that's what this facility can do. And it's so important to the First Lady. It's really important to all of us.
Yeah, that's terrific, Chief. I know those are going to be opening soon, very soon. So, Deputy, you're a very active and physical guy. You like to hunt, fish, take care of livestock. You're involved in coaching Little League, baseball, and other sports, an outdoorsman. Can you describe the benefits of outdoor activities?
Well, really, Chief of Staff, that is, I think everybody can see a lot of those benefits. If getting out after, as kids, we remember those rainy days, and it seemed like they would go forever. And then when you first got outside, it would always put a lot of new spring into your step and add life to what you were doing. And I think that's important to remember. Just last week, as I was at a baseball tournament and look around, and there's folks there from all over. One gentleman sticks out in my mind as Chip Cochran. He works for our housing authority and has for a really long time, and his family. He's been responsible for a lot of baseball players doing a lot of things. But when I look at Chip, I think of the longevity of life that he's been able to benefit from was because he was at those games and he took that time, not just with family and friends, but with those kids. And as you're moving up and down, I looked just last week and I took 20,000 steps in one day. And it was just basically coaching. I think I was marching back and forth. But anything, we know what, it's scientifically proven. There's when they talk about getting out in the sun, you've got vitamin D, and we know what that does to the body. And then there's certain things that have to happen chemically within your body that make that outlook a lot better. So, and to relieve stress, to go out a lot of times, and what we've done for ancestors have done for years to put food on the table, and now it's more of a recreation. For some, it is still a way of life. It's a Cherokee life way, and that's to get out and hunt responsibly. Just taking what you need to eat, and there's something about sitting there in that setting and just listening to the things that are going around you, watching the squirrels, watching the turkeys go by. If you're fortunate enough to still have turkey in your area. That I remember the stories, Chief of Staff, from when they used to do a lot of quail hunting and stuff, when we had a lot of quail. So that leads to when you're sitting there thinking about conservation efforts, thinking about other things than just the day-to-day grind that you may be in your life. So getting out, staying active, keeping up with the kiddos, family reunions. It's that time of year. We've got the Strawberry Festival coming up. We've had other towns that have big festivals. So it is paramount that people get out and stay active for one reason or another, even if it's for a short period of time. And it's been told to me by many Cherokee elders that Cherokees, they have to have that sunlight and that outside light. We like that type. So a lot of windows in our office space, and these are things that they bring to Chief and I and to you and talk about, hey, it's so important. So not only if we can't get outside, but to be able to bring that in, it's so important. And just if people are starting to exercise and to maybe take up a new hobby or do something, just taking that time to walk, that is so important. It's low impact, and it'll mean the world to their health, to their blood pressure, to all those important numbers that doctor needs to see.
Well, Deputy, I absolutely agree. And the more you can be outdoors, the better you'll feel. Just take some sunscreen and some bug spray, right?
Amen. Amen.
Lastly, Deputy, can you share with us why these initiatives are so important that your administration is dedicating $500 million, including the new hospital, to these efforts on our reservation?
Well, as Chief well knows, I think we're both excited, because what that means is what type of future are we building? And I talk about it, and it's nothing that came from me. And obviously I want to hear what Chief has to say, but it's important to know that every generation has to plant a seed, and we have to be diligent, and we have to nurture, and we have to work with the Creator and to do things. And if that means dollars and all these things, that seed, it'll grow into something that will provide shade to those future generations. So for me, it's Cherokees, whether they're elders, whether they're middle-aged, whether they're young, they deserve the best. They deserve state-of-the-art. We're in the 21st century. We have to learn how to figure out what are our Cherokee life ways, what are our traditions look like in a 21st century world, to not forget our past, but to perpetuate things like our language, like our culture, our health, our housing initiatives, and all these things. It means the world to me. And one thing that I've always been willing to do, and I've committed to this man that I'll work beside him and in any manner that he is, but I commit myself to the Cherokee people. And I don't, if I make that commitment, I try to stand true to that commitment. But Chief, what does this mean to you?
Well, we start with the basic idea that what we all want is wellness, and that takes different forms, and you get there by different means. I'll never forget when we took office, one of the things the Deputy Chief challenged us to do is to think about how we can give the Cherokee people an opportunity to be their healthiest before they even set foot in a health center. And so that's why we're taking this holistic approach. $500 million is a lot of money, and certainly a lot of that is directed towards the hospital that we're going to build in Tahlequah to replace the old one. We have to do that because we have to expand capacity. We have to make sure healthcare is delivered efficiently, most importantly, effectively in a hospital setting. We have to replace the Salina Clinic. Those are two examples of sort of the traditional delivery of healthcare. But we're also thinking about what the Deputy Chief said about how can we be the healthiest outside of the clinic setting. And that's why what he said earlier about outdoor life is important. So we've made investments in giving people an opportunity to enjoy the outdoors. That's why we're investing $10 million in a wellness center in Stillwell and $10 million in a community center in Kenwood. And we're not stopping there. We're looking at little communities like Marble City, and we've got to invest there to give people a space to get well, mind, body, and soul. If we think about wellness in those terms, we find the resources to invest in the Cherokee people. Sometimes it takes the form of the biggest capital investment ever, our hospital, and sometimes it's as simple as a walking trail. Both of those can make all the difference in the world, but it's really all of the above because it's about wellness.
Well, Chief, gentlemen, for your leadership, your passion, your vision, the courage it takes to make these tough decisions that's required by the positions that you guys hold. I know I feel inspired by the wisdom and knowledge that you both share. I work beside you guys daily. I know your work ethic and the work that you put in for the Cherokee people. I know that you have trust in your cabinet members. I know that you guys listen to our citizens, our Cherokee citizens, and you do all these things so that our citizens will have a more fruitful and satisfying lives. So, what do? Recently, on an episode of the Emmy Award-winning OCO, Voices of the Cherokee People, Cherokee citizen, mother, nurse practitioner, and ultra marathon runner Lori Enlow talked about the trials and tribulations of the sport and what motivates her to keep going. Let's take a look.
I'm Lori Enlow. I am a mother of three, wife, and nurse practitioner and ultra endurance runner. So a typical day for me starts out, if I have a run in the morning, it depends on my run schedule. Actually, kind of everything revolves around my run schedule now. So depending on what my run is that day, I may get up at 4:30 and start my run. It's anywhere from 5 to 9 miles, depending on the day. And then get home and start waking kids up and getting ready for work. And then I head off to my day job, which is I work for an elder program. And my clinic day is seeing all high-risk elderly patients. I think the most important thing for me is balance. So trying to find balance. I love racing, and I'm very type A personality, so very driven. And if I have a goal, I want to go straight after it and focus on that 100%. But life is a balance, and I have lots of goals. I have primary goals. My primary is my kids, my family, my husband, my work, and then running is the fun one on the side. It eats up a lot of time and it eats up a lot of energy, but the running and the racing fuels me in the other areas of my life. And I don't always love running. Training is tough. but it gets me to be able to see amazing places and do amazing things that I couldn't do if I didn't put in all of the training. My first introduction to running was probably my dad. He would go out on the weekends and run 5Ks, and he would get up early in the mornings and go for runs, and that always intrigued me. And then over the years, I would run intermittently as a teenager. When I was in high school, I did do track for a little bit, but never really enjoyed the workouts or just the track work. I really enjoyed being out in nature and kind of on trails and off the beaten path a little bit. For me, training's the hardest part. Racing's the easy part, per se. You're in a beautiful scenery, you've got tons of people cheering you on, everybody's rooting for you. It's hard not to get through the tough times for me in racing. And then when I'm done, it's an incredible feeling of accomplishment to finish that and to go, you know what, I was able to stay in it the whole way. And part of that's the allure of it, is to see, can I overcome those challenges, or can I meet those challenges and work with those challenges and grow and become better and stronger through those challenges. And for me, that's what racing is about too.
Now we welcome Senior Public Health Advisor Canaan Duncan and Senior Director of Public Health Lisa Pivec. Siona God. Canaan, I'd like to begin with you. Can you tell us a little bit about Chief Hoskin's new Public Health and Wellness Act, as well as the Physical Wellness Task Force?
Absolutely. Chief Hoskin has signed into law a legislative act that earmarks 7% of unrestricted revenue, which is revenue that is coming in from our third-party billing, insurance, and earmark those dollars to go towards advancing existing programs and creating new programs for in the realm of wellness. And as far as the task force, Chief Hoskin signed an executive order creating a task force to look into what we're currently doing as a tribe in terms of physical wellness, and identify areas of need across the reservation, as well as new programs that's going to be beneficial to Cherokee citizens. And members of that task force is myself, Ms. Lisa Pivec, Kevin Stretch, who's the Director of Community and Cultural Outreach, Howard Payton, the Executive Director of Cherokee Language Department, and Senior Advisor for Education, Aaron Emberton, which is an array of departments represented, but it's necessary because we're approaching this from a holistic point of view for overall wellness.
Okay, that sounds great. You know, a wide variety of stakeholders, it sounds like. So looking forward to that. And I heard Chief say earlier, over $12 million a year. So that's fantastic. Lisa, your program has done considerable research regarding the things Canaan just spoke about. Would you mind elaborating a little bit on the findings of those?
Absolutely. Good question. The public health staff has worked in a couple ways. We look at this in a couple of ways. One way is we obviously do the scientific research, what's in the bodies of literature, in public health practitioner work, and we look at what are best practices. We rely on the Centers for Disease Control, and we rely on other practitioners across the country to look at what public health practices work best in communities. But the second piece, and the most important piece that we do, is we look at it from a community component. The public health staff is not only scientifically and trained, but they are also members and citizens of our communities, and they grew up and live in these communities. So they can provide not only that perspective from a scientific point, but they can also look at what they know and live in. So we've done lots of work on inventorying what's in communities. We look at what community opinions are, and we also look at vulnerability studies and then take those out and to prioritize where we need to do our work.
Well, that sounds fantastic, Lisa. They have the professional expertise and the firsthand knowledge, so that's great. That's great work that you and your team have done, Lisa. So, Canaan, will you be seeking any input from those tribal counselors and citizens who live near one of these future sites?
Absolutely. That's something that we've focused on as the task force, is to make sure there's community involvement. One way we're doing that is, of course, Lisa and her team have developed over the years data that's extremely helpful. But to add to that, we're developing a survey that's almost completed. And that survey will be out for Cherokee citizens to access through the Gadugi portal. And it's very important that we get that input, because we want to hear what those citizens want in their communities, because they know their needs. And we have also started to engage tribal council. We're engaging them in terms of their districts that they represent, because we have identified hotspots within the nation. We've begun in Adair County talking with the 2 council members there, and that it's imperative that we do that, because they're elected to represent the Cherokee citizens in that district, and they know the needs of their communities. And so it's been beneficial in that process, because we're developing a wellness center that's going to be state-of-the-art there in Stillwell.
Great information, Canaan. Now, Lisa, can you tell us how this new programming and the new facilities will impact Cherokees and prepare them for success?
Sure. When we talk about wellness in communities, we talk about the holistic approach that Chief and Deputy Chief mentioned before and had talked about. And for a wellness center in a community, we envision and we hope to have not just exercise or programs and equipment that individuals can use, but we hope to make it rich with gardening, cultural activities, stress management, all of the things that you might need to be well, because those include a lot more than just going to the doctor or exercising. And it's very important for our Cherokee communities to have this access to this kind of facility. But I also think the facility itself will be in the community in different ways. So it's not just a facility, but the programs within it outreach into smaller areas as well.
Well, that sounds wonderful. I want to say wado to both of you for this very enlightening discussion, and I really can't wait to see the outcomes and the success of this program.
Thank you.
Wado.
Coleman Cox struggled with addiction during his early adult life. Fortunately, with prayer, determination, and a supportive Cherokee community, he is successfully in recovery now and spends his days paying it forward and helping others with addictions. Here's a clip of his story.
I grew up in a small community. I had a lot of support. I had 2 working parents who worked very hard to provide me with a great life. I had lots of opportunities to succeed. All the things that you would expect would lead somebody down the straight and narrow path. So I went off to college. One night I was in my dorm room and I overdosed. I can't do this on my own. My life has become unmanageable. I need help. I went to a treatment center, which helped me understand the underlying forces that were driving my need to seek a sensation other than being sober. There was some untreated trauma from childhood that I had never told anybody about. I didn't realize it, but I was self-medicating to cover that trauma. I hit my knees and I prayed to God and I said, God, take this addiction from me. If you're there, if you're listening, and you have good plans for me, take this away from me. And I believe He did. I worked my recovery. I didn't fight against my recovery. And so all these new skills that I put into place helped me every day to stay sober. And that's what I try to help other people do, is discover the skills that they can use to help them stay sober. I started with Cherokee Nation at the Jack Brown Treatment Center. And I started as a technician who worked directly with the clients on day-to-day activities. And I noticed that there were some clients that would leave and they would come back, and they would leave and they would come back. What can I do to help them and more people like them so that they're not in this vicious cycle constantly in and out. We do know from science that 1 in 10 individuals will struggle with substance abuse. It's a genetic issue.
When you're born a Native American, you already have the predisposed genetic material to misuse substances. We know through biology and epigenetic research that if you've had a parent or a grandparent, who have been through a significant stress, such as forced removal, such as boarding schools, that can translate in epigenetics and into the DNA of their children and grandchildren. It gets stored in your brain, the trauma. We know a lot more about trauma now. There's so much misunderstanding about what addiction is, and therefore people have a misunderstanding of how to treat addiction.
Cherokee Nation Behavioral Health has been a leader in Oklahoma for helping people with a wide range of issues. I would like to welcome two of that wonderful team, Juli Skinner, Senior Director of Behavioral Health, and Director of Medication Assisted Treatment Program, Ashley Lincoln. Hello, ladies, for being here. Juli, what types of behavioral health issues does your team face?
So in behavioral health, we have faced a lot of challenges recently, especially with the last few years with COVID. Our Cherokee families and within our communities have really encountered a lot of challenges from the COVID epidemic with a lot of loss. We had many families lose family members. They lost jobs. They were displaced from their daily lives. The normal routines that they had were disrupted. And so a lot of them turned to other ways to cope. One unfortunate way was drug use. We had a lot of overdose deaths happening during this time. It's just the COVID epidemic really exasperated already a challenging situation for many of our families. And so our team was already trying to meet the current need, and then on top of that, additional situations were happening within our Cherokee families that really caused us to fall behind on meeting the needs of families. With our staff also experiencing these same kinds of events from COVID, we're also having to take care of their own families in addition to the extra load that was coming on that was brought forth through COVID. And so just trying to meet the need and being not able to meet the need also took a toll on our mental health as well.
Well, thank you for that, Juli. It sounds like your team's really been into overdrive working to meet all the needs. So, Ashley, the opioid epidemic has been especially devastating in rural Oklahoma. Can you talk about what Cherokee Nation Behavioral Health is doing to combat this epidemic?
Definitely. So some of the things behavioral health is doing is we are doing medication-assisted treatment, and we call it MAT. And what that is where we prescribe Suboxone, which is a combination of buprenorphine, which buprenorphine blocks the opiate receptor, which reduces cravings. And then it also has naloxone, which reduces opiate withdrawal. And so with that prescription, we're able to help citizens who have an opioid use disorder. And it's really great because, if they come into our clinic, we're able to induce them that day, and that's where we are able to give them that medication. And then we're able to connect them with a therapist. And that's what makes MAT, we're not just a Suboxone clinic. We have behavioral health with those therapeutic interventions. We're able to teach them coping skills, and they don't have to be away from their family. They don't have to go away to treatment. They're able to come into our clinic, and then they're able to return home that same day. Another thing that we're doing is a lot of community work. We have a whole prevention department. And so they're working in the community to provide education around opioids, the dangerous effects of opioids, how addictive they are, and then also providing the community with Narcan. So, and harm reduction, because we want everyone to have Narcan on them. So, with fentanyl now, a lot of our patients, fentanyl is here, and it's very dangerous. And we're seeing that 4 Narcan is what we're needing to reverse the effects of fentanyl. So we want to make sure that community members have that and that they know how to use it. So if they come across somebody that they think may be experiencing an overdose, they can help them until they connect them to care.
Well, Ashley, that's amazing. I really like what you said about the prevention part of it, but also the MAT and the treatment gets them service right away. So yeah. That's amazing. So thank you. Juli, just a moment ago, we heard Coleman Cox's story where he authentically shared his experiences with addiction and recovery. Could you talk to us about a behavioral health team and what inspires you to continue to do this work?
Oh, I'll try not to get emotional when I talk about that. I think when you're in behavioral health, there's something that draws you in there. I noticed with our team in behavioral health, they're there for a reason. They have a personal experience, maybe with themselves or with their family members, that draws them into the work that we do. For me personally, I was raised in a very traditional home. My tribal language was my first language. And then growing up in an environment that wasn't very open to a different environment than what they were used to. So you learn to almost hide those types of traditional aspects of your family. And so that's how I was taught to hide that. But however, growing up and starting to work within our systems, the protective factor of my tribal culture really protected me from some of the really more detrimental outcomes that I saw a lot of our tribal families go through. I was very, very lucky and very blessed that I was able to use my tribal culture in our ceremonies to really protect me from a lot of the issues that I saw a lot of our Native American families go through. And so coming over into Cherokee Nation, been with the tribe 22 years now and worked in child welfare first and then moved into behavioral health because I saw in child welfare the same problems happening over and over again. You saw we would work with the parents and then their families. Their kids would be in the system and then their kids would be in the system. And it was a cycle that we could not break. Introducing the opioid epidemic that happened back in the early 2000s, we didn't know what was happening or what was hitting our families. And so I felt very unprepared. So going back to school to understand how we can help our tribal families. And so that's why I chose to go back to school into social work and learn at the community level, at the micro level, at the macro level on how we're going to address this issue, because you have to address it at all three levels. You have to be able to provide services one-on-one with families. You have to provide services within the community, like with Mr. Coleman Cox is doing, and you have to address it at the policy level so you can start to get your policies in place that are best practice, that are going to introduce programs like our MAT program, that you're going to do community prevention, that you're going to address the whole entire issue on a holistic level. So that's really what drives me to come to work every day, and hearing stories that I get to visit with my supervisors, my directors, and that's what powers me, because we are making a difference every single day. Even if you just touch one person, it's enough.
Well, Juli, I appreciate your passion. That was a terrific response. I know you have lots of expertise in this area and firsthand knowledge. So Cherokee Nation is very lucky to have you in this position.
Thank you.
Yep. So let's switch gears a little bit. Ashley, what can Cherokees watching this program do if they or a loved one has behavioral health issues?
Well, I think it's important to know what constitutes a behavioral health issue. And so it becomes an issue if it affects your daily life, if it affects me being able to go to work, if it affects my relationship with my peers or my significant other, and to use I statements. You know, when you have a conversation saying, you know, I've noticed a change in your behavior and your emotions and I'm concerned, goes over a lot easier than you're acting different, like what's up? And coming from a place of just unconditional positive regard. You know, that's what we do with the citizens that we serve. They are worthy of care. And we come against this stigma with those with behavioral health concerns or with substance use disorder. And they have this shame associated with it. And I don't understand, you know, I understand why, but that perception and that negative perception, because you know, one of the things we always say is there's no difference in seeking help for a broken arm and feeling broken. Your mind it's a part of your body. We don't exist in a vacuum. And, you know, we talk about that holistic care. And so just unconditional positive regard. I notice you're going through something and I want to be here for you. How can I do that?
Well, that's terrific. Really appreciate that answer, Ashley. One last question, and this can be for both of you or either of you. How can viewers at home get more information on this topic?
So they can contact Cherokee Nation Behavioral Health. That number is 539-234 5000 and to find out information about all of our services. So prevention, if you are in a community and you want to do a community seminar on how to administer Narcan, we can help connect you to that. And one of the great things about behavioral health is if we can't provide you care, we're going to find someone who can. We have family care managers, and they are amazing. And they're there to help with those resources that maybe aren't appropriate for a clinician. So they can help you with those basic needs. So maybe you need help paying your water bill or things like that. They'll help you find those resources. And if we can't get you into services in the time that you're needing, then they're going to look at community resources to help connect you to care.
Well, ladies, for the great information you've provided with us today on this very important and serious topic. Next up, we hear an important message from District 6 Tribal Councilor Darrell Legg.
OCO, I'm Darrell Legg, Cherokee Nation Tribal Councilor for District 6. I represent Eastern Sequoyah County in Northeast Oklahoma. Today, we have heard about our efforts our tribal government is making to address holistic care of our people, body, mind, and spirit. Doing these things, investing in wellness programs and facilities will only make our nation healthier and stronger. As a father, I know how important access to physical activities are for our tribal youth. I also know that having enough healthy food enables them to succeed in school and how important it is to have a healthcare system that can support them throughout their lives. One of the things I'm most proud of is the commitment by our leadership, the Principal Chief, the Deputy Chief, and the Council of the Cherokee Nation to address the behavioral health issues. Because we know mental health is just as important as physical health, we have committed funding that will expand addiction offerings. Our families and communities have been hit hard by the opioid epidemic. Cherokee Nation is building a system of behavioral health experts and addiction programs. When we bring sobriety to people in need, we will impact the physical, spiritual, emotional, and mental well-being of Cherokee people today and for the next 7 generations. I know that's a future we all aspire for. Our tribal nation is strong and our people are strong. And we will be even stronger as more programs and services are rolled out to meet the needs of our communities across the reservation. It is positive, productive, and proactive, and it's what our people deserve. That's what a responsible government does for its citizens. Wadon.
Well, Councilor Legg. Now, Community and Cultural Outreach Director Kevin Stretch will deliver our closing remarks.
As a Physical Wellness Task Force Directive states, it is in the national interest of the Cherokee Nation to maximize the physical well-being of Cherokee citizens as part of a comprehensive, holistic approach to wellness. Wellness adds to our longevity as a citizen, but on a higher level, their longevity is vital to our culture, to our family, and to our language. The longer our elders, our Cherokee speakers, our cultural keepers live, the more time we have to hear and learn their stories, hear their words, their culture, and spiritual knowledge, so that we may pass it on to future generations. Mental wellness has been a struggle for us all, especially the last couple of years. Now is the time to learn about walking in balance and living in peace, beginning with yourself and your family. So that family by family, we can live a stronger Gadugi, working together. As you may know, one of our Cherokee values is for everyone to take responsibility for one another's well-being, and that starts with ourselves. From a personal perspective, I always feel healthier and happier when I'm exercising, being outdoors, and eating right, especially with family and friends. So I challenge each of you to spend a little time on you each day. Our young people are watching, so set a good example. The Health and Wellness Task Force, in concert with the administration, are considering measures that would benefit at-large citizens. We'll keep you updated on the progress at CherokeesAtLarge.org. Wadon for watching. And now, Cherokee National Treasurer Tommy Wildcat will close us with some music. Tommy?
Tō tāko hae, tā kāta ane iawia ne te laki.